birth control or birth spacing or determining the number of children to have is not family planning. That is the topic of discussion on this video. I want you guys to get a pen and paper and take note of this lesson I'm teaching today. My name is Dr. David AYEM. I am in Bamenda, Cameroon. I'm your reproductive health expert. I am your midwife. I'm your consultant on the media, like this one. I hold a PhD in public health, but have chosen to be there for you so we can communicate reproductive health. Thank you. Please, if you have not been part of this channel, just subscribe now. Then you like and share. You can make comments at the comment section. Thank you. Let me come back to the full lesson now. I have said birth control or birth spacing is not family planning. So what is family planning? The knowledge on how to make a family is simply what you call family planning. So it is not some palpable substance. It is not some medicine. It is not some injection. It is not some implant. It is not some coil to insert in the womb of a woman. It is not like some operation to do vasectomy in a man. It is not like an operation to do bilateral tubal ligation in a woman, what they normally call torn belly. You know, we need to be careful the understanding we attach to the word family planning. This video is to dispel the rumors, is to put a stop to the misconceptions. It is to clear the minds of the people of the world, not only the Bamenda people where I am, not only Cameroonians, not only Africans, but people of the world at large. Family planning, my dear brother and sister, is any approach, any measure, any attempt you make towards having a happy and satisfactory family. A unit family in this context is made up of a father, a mother, and children. Everybody, as you grow to maturity from childhood, you are hoping to one day get married and make children. That is formation of a family. So family planning, just as it's titled in the health profession, whether you're in the university or in a training school somewhere, a course is titled family planning. A lot of people think that that course is to teach you how to prevent pregnancy, is to teach you how to control birth, is to teach you how to space birth. It is to teach you how to determine the number of children you want to have. I want to shock you today that it is not true. If it was true, my dear brothers, it means that some people in life are exempted from family planning. It means that reverend fathers don't need to hear about family planning. It means that reverend sisters don't need to hear about family planning. It means that Catholic Church Christians, let me put in quotes because a lot say that Catholics don't say anything about family planning. They don't. I want to also tell you that it is a lie. I am not a Catholic Christian, I'm a Baptist, but I've also worked with the Catholics. And there I have known that, like what people say in the quarter, that Catholics don't do family planning. Oh, they don't talk about family planning. It is not true. They talk about it in a very constructive way. In the bishop house, there's office that handles family planning. Usually unfortunate that the family planning they handle will take one side and leave the other. Of course, you will know that when you come to contraception, where that whole idea, birth control, birth spacing, when you come to it, they will tell you that there are modern or artificial contraceptive methods, and there are also natural methods. When you go to the bishop houses, you have people who are trained. They will teach you all natural methods, but they will not want to talk anything about it. That depends on them. That's not what we are saying in this video. All of that is what they call birth control, okay? Spacing of children, determining the number of children to have, and so on. And I want to tell you that keep that aside. Let me tell you exactly what family planning is, which involves everybody. Do not invent your own thing and make the people around you to understand it so that people begin to stay away from it because of ignorance. If everyone understands what family planning is all about, every human being will be involved. It concerns everybody as far as you're a human being, especially people of reproductive age, man or woman. This family planning I just defined is made up of several aspects. Are you writing? Aspect number 1, sexual and reproductive health education. Who on earth would not like to have knowledge about the difference between a male and a female? Who would not like to know how the reproductive system in the man is made up of and how the reproductive system in the woman is made up of? Who will not want to know why breasts grow on the chest of the woman, why the buttocks shape out, why hair grow in the pubic area, in the armpit, and so on? Who would not like to know all of that? Why menses, why a woman has menses on monthly basis? Who would not like to learn about that topic? Don't you know that just learning about sexual and reproductive health is family planning? What others just call in short form sex education. Is sex education only for some particular people? Only for some particular culture? No, sir. Then you have missed a point. When you go to a family planning unit, like here in my office, in my clinic, we do family planning. I am a trainer of trainers in family planning. Even when I was just a family planning provider, there are the services that are put at our disposal. Anybody in the community is concerned with family planning, but not everyone is concerned with birth control or spacing of children or whatever. Because if family planning was about that, then a lot of people will stay them away from family planning. But today I am drawing your attention to what family planning is all about, which is different from what you think. That's number 1. Sexual and reproductive health education. They teach you everything about what it takes to be a man, what it takes to be a woman. So it is knowledge for everybody. Number 2, premarital counseling. Those people want to go in for marriage. They will come to us. They will go to a family planning unit, meet a family planning provider. There is a series of activities they will carry out and educate both you, the man and the woman, what it takes to come together. If both of you are even first of all compatible to be together as husband and wife. Did you know that? Did you know that that's a service at the family planning waiting for you? Those of you who fumble every day when you want to get married, you instead go to your church and see a pastor or see somebody in the name of spiritual leader. They do their counseling. That's correct. But they are doing spiritual counseling, my dear brother. When you finish from there, go for medical premarital counseling. Some pastors, some reverend fathers have gone as far as telling people that we are done with you here. Go and do your HIV test. Go and do your hepatitis test. A pastor doesn't prescribe a medical test. Only a doctor does that. You come here. If you want to see me, come here. When I've talked to you, you go to see your doctor in any country where you are, in any quarter where you are. Hospitals are everywhere. Doctors are everywhere. They are trained for you. Go to the hospital, see your doctor, and talk about you want to get married. This is the person you're thinking of getting married. You'll be surprised at a lot of knowledge they will expose to you and a lot of examination they'll carry on you and your wife, and then be able to encourage both of you to go ahead. Take, for example, only on genotype. If your woman is incompatible with you, which medical doctor will just allow you to get married? He must advise you medically before you take your decision. Did you go for that? Do you even have any knowledge of what it takes for a man and woman to start living together as husband and wife and start having sexual intercourse? Do you even know what sexual intercourse is? They teach you. We teach you as a service. All family planning providers have been taught. Go to them. Acquire that knowledge. Number 3, pre-conceptual counseling. Are you writing? Pre-conceptual counseling is teaching you on what it takes to get a pregnancy. A lot of people even get married without going through premarital counseling, and then they start fumbling things, meaning think that when you start having sex, you're looking for pregnancy. Lies, sir. You need to be taught. You need to be directed. The system of a woman ovulates only once in a month, in the cycle, in the menstrual cycle. And somebody should teach you to recognize the fertile period of the woman and teach you when to target sexual intercourse that is fruitful. Now hear from me. If you begin to fumble and having sexual intercourse on daily basis, even two times every night as you have been doing, pregnancy is very far from you. You cannot be pregnant. It can only be the grace of God that you can see a pregnancy with that kind of ignorance. Because the system of the woman cannot produce egg every day. It produces egg only once in the whole month. Try to study to know when that egg is available before you supply the sperm. So just know that all the sex you're having every day is for your pleasure. But if you are looking for pregnancy, it is business. Are you out for business or you are out for pleasure? Take note, they will teach you what it takes to prepare a woman for pregnancy. That is a service in the family planning unit. Have you gone there? Now, number 3. Is it number 3 now? Number 4. Diagnosis and management of infertility. Infertility is inability to get pregnant, no matter, especially after being with a man and having regular sex without any contraceptive method, and you have gone for more than 1 year and there's no fruit of the womb. Please go to family planning. Go any hospital, just go and ask, where is the family planning unit? Go and tell them that you're finding it difficult to get pregnant, or you're finding it difficult to get your wife pregnant. There they will put you down. It is the staff of the family planning that will identify what could be the cause. And then they'll treat it and direct you. You get the pregnancy. Then you give thanks to God. Did you know that? A lot of people, they instead think that family planning is to stop people from giving birth. Lies, sir. If your wife is not giving birth, come to family planning. If the problem is in you, the man, they will identify it. If it is in the woman, they will identify it. If it's just ignorant, they will teach you, direct you, and you have what is correct. You have the children. Number 5, sex determination. It is a big service in the family planning unit in the hospitals, wherever, except the people are not trained. If they've gone through the kind of training I have gone through and what I have been teaching, then somebody can direct you on how to determine the sex of your child. Maybe to show you how to get a boy child, to show you how to get a girl child, even though a lot of time people instead say, show me how to have twins. But to differentiate from a male and female, it is possible, sir. That's one of the things that I do on almost every week. That you have couples visiting in this clinic here for counseling on sex determination. This one will tell you that, doctor, we have had 4 children, we have had 5 children, they're all girls. What do we do? We wish to have a boy. We'll put them down here, teach them, direct them to follow our directives and get the boy. The ones that need a girl, they follow our directions and get it. It is never 100% a kind of probability, but we can put you on a 90%, 95% chance of having what you want. Apply that knowledge, then God will do the rest. Number 6, screening for breast cancer. How many women go even once in a year to check their breast? It's a service of the family planning unit. go there. Is that birth control? Are all these things I'm listing like this, is it birth control? Is it child spacing? Why do we misconceive? Why do we misinform the community? When services are in the hospital, instead of us going for it, there are some people that if they even hear the name family planning, they say, hey, we have not had enough children. As if you need to have enough children before you go to family planning. No, sir, no. That is the area every woman, please, when you have reached puberty, age of sexual maturity, go to family planning unit for your breast examination. They will also teach you how to do breast self-examination, so you can even be examining on your own. Anytime there's any nodule, you notice it quick. Number 7, screening for, sexually transmissible infections / HIV/AIDS. Do you know that it is a service of a family planning unit? Wherever, go there, just tell them that you want to screen yourself for sexually transmissible infections, HIV and all that. That service will be done. Does it not matter who you are? The kind of position you hold in community? You need to go for this service. That's family planning. Number 8, screening for cervical cancer. Especially ladies that have been sexually active. You have been having sex before. Even if you are as young as 14, 15, 16 years, please, if you know that you have already been having sex, go for your cervical cancer screening. Yes. These are services we do even here in my own clinic. But you're not seeing the population making use. But you find population crying in the community because of one mistake or the other. It is lack of knowledge. They will screen. And if there is any pre-cancer cells discovered early, the earlier they do the diagnosis, the better, because it can be treated. Don't have it and stay and you don't know, and by the time they discover it is already too complicated that they cannot help you. It will be bad. Now, number 9, meaning that what? I've given you up to number 9 aspect of family planning. It is this number 9 that brings the idea of contraceptive technology or contraceptive methods. What does that mean? How to prevent pregnancy. Meaning, if you have had all other information and you have put your head together until you start having children, you are still the one who will at one time have a baby and you desire to space that baby. You may say that I want my baby to make at least 2 years or 3 years before I get pregnant for another. Ask yourself, within these 3 years, will you still have sex? If yes, how will you protect yourself from pregnancy? Because sex can bring pregnancy anytime. What if you have given birth, or your wife has given birth, and baby is just about 2 months, 3 months, and you discover that the wife is pregnant? Yes, it's possible. Possible. In the hospital here, a lot of women come 2 months, 2.5 months, 3 months after birth, after they gave birth, and we discover they're pregnant. They start crying, doctor, this baby is too small. This baby, you should have known that now that you have given birth, you will resume sex someday. This is the reason why technology devises various measures to put at your disposal so that you can use them to prevent pregnancy, so that you can use them to maintain a good sexual relationship in your marriage, in your relationship, so that you can have sex any time of your choice, but you will get pregnant only when you choose to be pregnant. Are you informed now? Are we communicating? Thank you. If you have a comment, please write in the comment section. If you want to talk with me personally, the contact is 694-353141. If you are not in Cameroon, always start with +237 before you add that number. Then you will get me. Only messages or voicemail. Please don't call. Bye-bye. Thank you for listening.